Hello, everyone. Welcome. This is our second event of our speaker series for this spring 2025 of the Center of Latin American and Border Studies speaker series. My name is David Ortiz. I am the inaugural faculty fellow for the Center for Latin American and Border Studies. And I thank you for being with us. Bienvenidos todos. Gracias por estar con nosotros. Les agradezco mucho estar aquí, su presencia y por seguirnos en esta lista de eventos que tenemos en el Centro de Estudios Latinoamericanos y de la Frontera de NMSU. Mi nombre es David Ortiz y yo soy el Faculty Fellow del Centro de Estudios Latinoamericanos y de la Frontera. Bienvenidos. Today, we have the fortune and honor to have one of our very own professors here at NMSU share their expertise and be part of our speaker series. So without further ado, let me welcome Dr. Jagdish Khubchandani and introduce him to you. Dr. Khubchandani is a professor of public health at New Mexico State University. Like I said, one of our very own. He received his doctorate in clinical medicine from India, his master's in public health from Western Kentucky University, and his PhD in health education and epidemiology from the University of Toledo. Within the past decade, he has mentored and taught over 500 students pursuing undergraduate and graduate degrees in the field of public health, nursing, and/or medicine. During this time, he has also co-authored more than 150 research articles in prestigious journals, such as The Lancet, Journal of American Medical Association, and the New England Journal of Medicine, with emphasis on global health, social epidemiology, and injury and violence prevention. More recently, his research has received widespread attention from prominent media outlets such as Fox News, MSN, Bloomberg News, Chicago Tribune, The Wall Street Journal, and Huffington Post. Dr. Khubchandani has also served as an elected director of the World Association of Medical Editors. And when I graciously asked Dr. Khubchandani to be part of our speaker series, I knew there was a host of topics he could talk about, and he chose gun violence, a silent epidemic. And to much of our dismay and of course, regret, we just had an episode of gun violence that happened in our very own city here, in our very own community in Las Cruces. And it has been a terrible issue that we're still mourning. So I with a lot of, I'm sure with everyone else in our community, find this regrettable. And hopefully, we can hear from an expert in public health about why this issue is so prevalent in the United States and why can we not seem to be able to diminish it at the least. Without further ado, I will let you know that you can use the Q&A button in your Zoom session. There's a Q&A button here, down here in your Zoom window that you can use to ask questions. We're going to start compiling all the questions. We will let Dr. Khubchandani do his presentation, and at the end of it, we will start asking all the compiled questions. So if at any point of his presentation you feel that you can ask a question, please use that Q&A button to do so. Finally, if you're interested in the rest of our speaker series here at the Center for Latin American and Border Studies, in the chat, you should have already all of our social media: Instagram, Twitter, Facebook, YouTube. And in there, we will post early announcements of our series, or of our next speakers. We have one more speaker for this spring, and it's going to be very, very interesting too. So please follow us if you are interested in knowing more about our speakers, our upcoming speakers, not only for this spring, but for the coming year. So they're right there. I just saw them in our chat. So make sure you add us. Also in YouTube, we post all of our speaker series. So if you cannot attend, or today you have to leave early, whatever happens, just go to our YouTube channel and you'll find all of our previous and up to date our speaker series once we upload them. Okay, without further ado, it's my honor to present Dr. Khubchandani, and thank you, Dr. Khubchandani, for being here with us. We appreciate your presence, and it is an honor for us to have you as our speaker here in March.
Thank you, Dr. Ortiz. I'm trying to know if you can see my slides here.
Yes, we can.
Okay. Thank you, everyone. And I can put this in my slideshow. My name is Jagdish Khubchandani, Professor of Public Health, New Mexico State University. First, we do want to acknowledge the shooting that just happened. We know that 3 people were killed and 20 injured. It's sadly not unusual. There will be more. What will change now is the time taken to the next mass shooting, which has dropped in the last 10 years. So more and more mass shootings do occur frequently. The purpose of this presentation is to bring more awareness to the issue of gun violence, and also know that we are going through different socio-political scenarios time to time, and oftentimes we don't realize how many people end up losing their life due to gun violence. So I'll start by sharing some numbers here. On an average, by the time you go home, I go home, or we finish the day, 100 people will be killed with guns. And this does not happen anywhere else in the world, especially when you compare United States to industrialized countries. People in United States are 25 times more likely to die from guns than people in peer nations like OECD and developed countries. As you can see here, the highest chance of death would be in United States compared to other industrialized nations. Also, if you take a random sample of 10 children killed of guns in these nations, 9 would be from United States. So again, you can see here, we have a global domination, the 15 deadliest mass shootings worldwide since 1966. If you map them, many of them are concentrated in the United States. And this is excluding conflict and war, but mass shootings by civilian handguns or rifles. 6 of the deadliest mass shootings in the modern history have happened in the last 10 years, with Las Vegas, Orlando, Blacksburg, Virginia. There was Uvalde, El Paso, Texas. And also not just people killed, but people shot. So on an average, it would seem like an average of if 40 to 50,000 people die every year due to guns, almost twice the number of people are also shot and injured, and they survive. And this has a lot of meaning for the overall cost of gun violence in the United States. So if you average out all the mass shootings and see how many people died, for example, in Las Cruces, we know 3 people died and 20 were injured. So almost double or more number of people are also non-fatally shot. What has changed now, our number of mass shootings continue to increase. There is some confusion about this number because FBI suggests that there are 4 or more people killed or injured in one incident in a public place due to a gun. That's a mass shooting. Some people say it should be 3 or lesser killed. But still, no matter what measure we use, it does seem like our mass shootings continue to increase. And if you take another view of this, the number of days to the next mass shooting has continuously dropped. Mass shootings increased. So our next mass shooting should now happen, unfortunately, within the next 2 to 3 weeks. It may not be noticeable, it may not appear in the news, but somewhere in United States, 4 or more people will be killed or injured due to guns in a public place, and that would be considered the next mass shooting. Um, in total, um, while we continue to know more about gun violence due to mass shootings, but most of these deaths don't happen due to mass shootings. Most of the deaths happen due to suicides and homicides. So, for example, in 2021, 2022, we have recorded the worst years in gun violence. 48,000 people died. The second highest total was 2022. 2021 was 48,400. So since the pandemic, it does seem like 2020 was a silent year. People were locked down at home, not going out, and we had a drop in the number of gun deaths. But now from 2021 to 2022 and onwards, it's increasing. Every 11 minutes, someone is killed. As I said, by the time we end the day, 100 people will be killed. 27,000 of those would be suicides. 2,500 approximately would be teenagers and children, and 18 times more likely to be Black children and teens. In this one, I want to mention that for 1 year, within the past 3 years, guns are now the leading cause of death in children in the United States, more than poisoning, accidents, injuries, other types of diseases. Guns are now the leading cause of death in American children. 9 out of 10 who die of guns in industrialized nations belong to United States. So we are looking at some post-pandemic effects here, and I'll try to explain why that would have happened. We do see an interesting trend now. Firearm deaths more than 40,000 per year, but what has changed is homicides may seem to decline over time, but suicides have remained stable or increasing, which could be a function of social, emotional health of the society. But it does seem like in the past few years, homicides may have stable, but suicides continue to be the higher killer of people through guns, and in recent past 2 years also seem to be increasing. So most people who die of guns actually don't die because someone killed them, they die because they kill themselves. And also, if you look at the adjustment by age and rate per 100,000, it does seem like from 1968 to now, we have 5 out of 100,000 people dying of gun homicides and 7 out of 100,000 dying of gun suicides. And this number seems to be increasing if you adjust by age and take the total population into account, which means there is a bigger priority here for prevention and remediation efforts. Next, I also want to highlight that there's some disparities and differences from all the gun deaths that we looked at in the previous slide. 48,000 people who died. The likelihood of some people is higher to die of homicides versus suicides, and that is showcased here. The total population of white people in United States is 64%, but the gun deaths are 56%. The total population of African American people nationwide is 10 to 12%, but gun deaths are 30%, almost twice the rate of their population. Huge disparity here. American Indian, Alaska Native, again, huge disparity, larger number of deaths compared to their population. Hispanics, almost representative of the population size, 10 to 12%, 15%, but there's a huge disparity here. And then if you also look by gender and intent, most of the gun deaths will be seen in males, 86% of all, homicides 84%, suicides 87%, and police shootings, most likely men are killed. Unintentional shootings as well, it's mostly dominated by men. Out of 48,000 deaths, most of them, almost 39,000 would be seen in men. Despite the fact that women are less likely to die of guns or gun violence, there is some disparity here as well. I merge the race and gender data to see the percent increase in gun suicides from in the last 5 years. The highest increase is in African American women, American Indian, Alaska Native women. So these groups, minority groups, are witnessing a large increase in firearm gun suicides among women. Also, women of color make up 63% of homicide deaths through guns, despite being only 43% of the US population. So this is a priority population. Even though there are lesser gun deaths in women, it does seem like there's certain groups of women who are more likely to be dying of gun suicides and homicides. Uh, I apologize for the crowded slides, but now I break this down by things we look at in terms of age and gender and race and stratify by what has happened. In the past 10 years, it has been said that guns will become the leading cause of death in children, and they have become the leading cause of death in children. What has happened is, for example, children less than 5 years of age clearly not own guns, but almost 100 die every year, 1,200 total in the last 10 years. And the numbers have changed. If you look at the column here, firearm deaths by race, ethnicity over time in children, there were more white children. And now in 2022, it's mostly African American children dying of guns. Whereas their total population in United States of African American children is 14%, their deaths are 48% in guns, disproportionately represented in gun deaths. Children, white children, 43% among all those who died with guns, now they're 28%. So we do see some increment in Hispanic children and Black children more likely to die of guns now compared to whites, despite their population sizes not dramatically increasing, but some increase. And so there is a lot of news these days about children dying of guns and what could be done to prevent such deaths. And this was about children less than 5 years of age. In the next study, we look at children less than 18 years of age. Almost 3,000 of them died with guns in the last 1 year. And there's a major spike in gun deaths in youth. And then we look at age and race differences. The other priority population is children or older. So in children, we see 3,000 deaths per year due to guns, children less than 18 years of age. For older people, there are more than 8,000 deaths per year. And we conducted a study looking at how are older people dying of guns, mostly suicides. And it is said that Americans aged 65 and up in 2010, 4,200 died of gun suicides. Now the number has increased to 7, and the latest year shows 8,000 deaths due to guns. And especially after the pandemic, when they have been left alone, feel socially isolated, their health needs are not being met. So we see a 49% increase in gun deaths, suicides in elderly populations. 15% of Americans are 65 or older, and the number is projected to increase to 25%. We are an aging nation, and there has to be some strategy to make sure that not too many older Americans die of gun suicides due to mental health issues, physical health problems, being left alone, or not being able to meet their needs. So this, again, we have seen a dramatic increase in children, priority population, older adults, and also, if we look at the deaths by type of weapons used, for example, 2013 total homicides, 12,000, 13,000 in 2015, and the homicide rate increased. But also see that the rate of gun usage increased in all these homicides, murders, and mostly handguns. Almost half of the cases, murders were committed by handguns, and most of the murders were committed by guns. And especially those who were killed, mostly male, 78%, 52% black males. And there was a single victim at a point of time, which means mass shooting does get a lot of media attention, but most gun deaths happen to single individuals. Um, and now I want to break it down by state. I hope you can follow this and see the trends here. So we look at deaths by state. Total number of deaths, we are here in New Mexico, 27 to 33 per 100,000 after adjusting for age. This is per 100,000 people. So every 100,000 people in New Mexico, it is likely that this year, 27 to 33 of them will die of guns. And we are among the top in the nation. The darker the color, the higher the gun death rates. And this is all gun deaths. Now, the next one looks at only murders, homicides. Again, 18 to 23 out of 100,000 people, adjusted by age, would die of homicides, murders in New Mexico. And again, we are in the top 5, top 6 for murders in the nation. Next, we have all suicides, irrespective of intent, method, guns, poisoning, suffocation. 27 to 33 out of 100,000 New Mexicans will die of suicide. I want you to go back and see this. Gun deaths, New Mexico ranks high. All murders, New Mexico ranks high. Suicides, all New Mexico ranks higher. There has to be some relationship between gun deaths being high in New Mexico and homicide deaths being high in New Mexico. Across the nation, we rank in the top 5. Suicidal deaths, all types of suicides. Again, we are in the top in the nation, top 5. There has to be a relationship with guns, and it does seem like many of our homicide and suicide deaths are due to guns. I give you some baseline statistics. It is assumed that this year, out of 100,000 people, 24 to 25 in New Mexico will die due to guns, which accounts for almost 10 to 15 deaths per day. We are the fourth in the rate of per capita guns, which means how many guns does one person own. We are the fourth in the nation, which means some people have multiple guns, more than 3. We are the third in gun death rates nationwide. Sadly, in the last 10 years, our gun death rates have increased 75%. I don't know if this is what is causing the state politicians to discuss new crime and safety bills, but there has been some discussion. They may have a special session coming up soon. Also, in New Mexico, guns are the leading cause of death for children, which is surprising because there used to be a time when across the nation and New Mexico, traffic injuries or any kind of injuries would be leading causes of death in children, then poisoning, suffocation, and such. But now guns have become the leading cause of death. We spend more than $5 billion per year on gun violence in New Mexico, which would count for healthcare, social services. Despite these statistics, we are not a heavily populated state. We are 36th in state population count with over 2 million people living in New Mexico. We are also in the top 5 for suicides and top 5 for homicides. And most suicides in New Mexico would be using guns, and most homicides would be by using guns. So it does seem like there's some relationship between guns and suicide and homicide nationwide and in New Mexico. And then you can go county by county. It does seem like some counties here, Bernalillo, around Santa Fe, Albuquerque, huge problems with gun violence. The darker the color, the more problems they have with gun violence and homicides and suicides. On an average nationwide, 15 to 16 people die of guns per 100,000. We are at 24. Almost 1.5 times more than the national average. And it does reflect in our gun ownership rate. If you look at all the states with high gun ownership, we have 58 guns per 1,000 people. Even though we don't have too many households with guns, we have 36% households with guns, but 58% people, 58 out of 1,000 people own a gun, which means that there are people with multiple guns. The national average gun ownership in households is 39% homes. 62 people on 100,000 have a gun, and 16 people will die of guns out of 100,000. So it does seem like the top states here, top 5 or 6, skew the national average, because if you move towards the East Coast, the gun ownership rates drop below 20%. Registered gun rates drop. This one is about household ownership, and this one is individual ownership. Both drop in the East Coast and states with tougher laws. And the gun death rates also drop in the East Coast, where they tend to have tougher gun laws. But in the South and the West, we have high ownership on the household, on a person, and the death rate also higher. In New Mexico, as you can see, firearm death rates per 100,000 people continue to surpass the national average every year. And maybe that's why we have so much of discussion in the state policy making bodies and in the legislative sessions. This is homicides by gun deaths by assault and homicide. So more and more gun deaths by assault using a rifle, shotgun, and other types of guns. And this continues to increase. And New Mexico should have this as an urgent priority to at least be at the national average and not be double the national average. I do give some statistics here. What logic would explain the high rate of gun deaths in the United States? We have, as of today, more guns than people in the United States. This is what the latest numbers suggest. We have approximately 400 million guns in the nation with 325 million people. This number continues to escalate, especially after the pandemic, when people started buying guns and we broke all the records in the past 3-4 years. And other countries, even if you look at per 100,000 people, we have the highest amount of civilian gun ownership. And as I said, we conducted a study during the pandemic. We sent a national random sample of people a questionnaire asking about gun purchases, purpose, reason. And it did seem like from 2020 to 2022, we had record number of background checks through FBI on gun sales. So these are handguns versus other types of guns. 2020 was the year when we had the maximum sales of handguns. And so we probed people. Almost 20 million guns were sold in the pandemic. And we asked people, what was the reason that you would buy a gun? How many of you bought a gun? It seemed like 1 in 5 people who participated in the study bought a gun. And their reason was protection of myself, my family, uncertainty of the pandemic, and many more young people, people of color, and women, educated people, people who earlier did not own guns, people with a master's, a bachelor's degree, people who are also left-leaning and also right-leaning. So we did see change in trends of gun ownership. It did seem like there was a rapid escalation of uncertainty and chaos in people's mind, and they started buying guns. Which is okay, as we wrote in the paper, it's a constitutional right. The problem is all these new gun owners, many of them did not get safety training. Many of them also suffer from mental health issues, family distress. And so the chance of looking at future gun deaths reducing is almost negligible. We don't anticipate gun violence and gun deaths to drop if the civilian ownership of guns has increased so much in the last 3 years. We have more guns than people in the country. And so the study was covered by a group of news outlets, but also reflecting this happens after every mass shooting. People start buying guns. Every election cycle, there is a huge surge in why people start buying guns. One reason is that they don't know if the policies will change, their guns will be taken away, and what will happen to the future economy. What guns come to United States versus what guns are made. We checked in our studies, approximately 5 million guns every year are imported in the United States, whereas US manufacturers, the 25 big ones and more, make 10 million guns. So 20 million sold every year, and most of them manufactured in the United States. The number of gun manufacturers has increased. Last year, 15,000 licenses were issued around the nation. Almost all the states except 2 have seen an increase in licensing. Gun manufacturers are also now providing less than 1% of jobs. Earlier, those were negligible, but now it seems their share of providing US jobs has increased, still remains less than 1% of all American jobs, and they generate $90 to $100 billion in revenue, directly, indirectly supporting jobs and economy. I do see this as a value for discussion. The total cost of gun violence in the United States has been said to be $2 billion. And so the argument is there's still this industry that makes so much money, and the problem doesn't seem to be so serious. It's only the mass shootings that bring the attention. So my goal is to look at $2 billion spent on gun violence in the United States is direct cost of medical care, but we don't count the funeral, the disability, the law and order costs, which could clearly exceed $200 billion is what we are looking at. So the business case of preventing gun violence is there. Gun industry does not make more jobs or money than the cost of gun violence in the United States. But we do acknowledge that people have different um, views on guns in the society. Those who support gun control believe that guns are to kill other people. They cause suicides. They can cause unintentional injuries. Criminals have become more confident. People are threatening each other. Those who support gun rights ownership, they believe they need to protect themselves. They have to stop crime if there's no law enforcement officers around or if they are in need. It's a constitutional right which is guaranteed, essential for some jobs, sports, collection, and many people also go hunting. So we have a divided nation. This line is divided mostly by um, political affiliation, race, gender, age. So in national studies, people have different views based on socio-demographic characteristics. But back to the priority population, this year will be a record year for children's gun death. Guns have now become the leading cause of death. 2,500 minimum will die this year, and the rates have jumped up tremendously. This is less than 18 years of age, and a lot of discussion also happens with schools and mass shootings in schools. I've been asked how serious the problem of mass shooting is in schools and for children. Actually, mass shootings in schools have become more rare. Most of the children who die of guns do not die in schools. But the disproportionate media attention goes to school mass shootings, taking away attention and focus from children dying at home, in the communities due to murders and unintentional accidents. So if you look at mass shootings, for example, 188 total number of incidents where 131 were injuries and 57 deaths. Total number of children dying of guns is 2,500 plus, and mass shootings are less than 200 injuries and deaths. So it does seem like mass shootings in schools may have increased. There is an identification of profile. I've said it multiple times. We know the profile of school shooters. Mostly they are teenagers, males, happen to be white. 51% would occur in high schools. 40% of these school shooters have a mental illness, end up committing suicide, 35%. And many of them had a past connection with the school, family trouble, um, issues of relationship. And so even if we make this a priority compared to all gun deaths, 2,500, if we have to focus on the 200 school shooting deaths, we know the profiles, then the actions have to be implemented. One more example, in recent times, there has been a discussion. I was asked by Bloomberg, can we use AI in preventing school shootings? And my response is we already have a $5 billion industry to prevent school shootings. What are they helping with that we need AI now? So we calculated children 5 to 18 years of age, homicides and suicides. The numbers are in less than 50 school deaths, homicides due to guns. Most of the gun homicides or homicides would occur away from school. Suicides, again, would not occur in schools. So the idea that mass shooting at schools is a bigger problem than child gun deaths overall doesn't seem to be a reasonable proposition, but they do get a lot of media attention. The politicians are forced to do something. The problem is that something is always, most of the times, if I may say, useless. So we conducted a study to look at randomized controlled trials and evidence on what works to prevent school shootings and reduce gun deaths in schools. To date, there has not been many programs that show that the new measures that we use and spend $5 billion, AI, backpacks, change in gates, security cameras, multiple other technology implementations, we are in a way wasting money. And this study was covered by a bunch of news channels. Washington Post said There is no evidence that hardening schools to make kids safer from gun violence actually works. The problem here is that we spend more and more money. It's wasted. Schools are thrown funds, and then they are asked to spend in 1 year. They cannot hire anyone because the funding expires in 1 year, 2 years. So they end up buying technology and devices. The problem is also with the fact that we don't know if any of these devices and measures actually help. And so billions of dollars are being poured for a false sense of security. The politicians have to do something. That something does not always help. And it's become a competition between schools to do something. What we suggest instead is a more comprehensive community-oriented approach, hiring of more school counselors, police officers that may help with reducing police shootings, but spending money randomly on devices and physical measures and hardening schools doesn't seem to help. I also want to note that when children go to schools and they are shown these drills with blood, and then they walk into these high security zones like they are in a war zone, it doesn't do good to their mental health. There are studies now showing that children do not appreciate looking at blood or extreme measures. So we ended up asking parents and principals what should be done to stop school gun violence and who's responsible. The principals and parents in both the studies, we found that felt neglected. They're not engaged in these conversations. They are given orders or they're just prescribed something that something is not useful. And so they ended up telling us the bigger causes of gun violence in schools, according to parents, is parental monitoring is missing. Parents don't pay attention. Principals agreed 70% that parents need to do better. School violence in general seemed to be a big issue of agreement between both parents and principals. Inadequate mental health services, 54% parents agree, 64% principals agree. And these are national studies of parents and principals. What they believe is causing gun violence in schools is not what we end up addressing. Community oriented measures. The parents nationwide, principals nationwide believe these are the big causes we need to address. Better children's monitoring, counseling, guidance, improving connectedness, reducing conflict, improving mental health services of children, and reducing access to guns. This is a big issue here. Almost 20 states now have child access prevention laws where parents are held liable if children get access to guns and threaten others or shoot and kill others. New Mexico had implemented this law in 2023. And now the state politicians, some of them are proposing that this should become more rigid, child access prevention law, which seems to be effective in reducing gun deaths in children. So we did these studies, and then again, the news media highlighted that parents are being ignored. This conversation needs to include parents. Uh, then we look at a slightly older age. What is the role of guns in children 5 to 18? Almost 6% of all deaths in this age group when children are starting to go to school occur due to guns. And as their age increases, more and more deaths occur due to guns. Children 15 to 18 years of age, 20% die of guns. And possibly because also their suicide rates increase in this age group. Who's more disproportionately affected? 41% African American, and 86% of those who die of guns are boys. And we published a study on role of firearms in teenagers, homicide and suicide. This is a vulnerable age here, and as you see, the jump in all the deaths due to guns occurs in teenage, middle high school age. Why do children consider suicide? Assuming that if we go beyond school shootings and look at the actual deaths of children due to guns, we did publish another bunch of studies here asking teenagers why would they consider suicide. To get relief from a terrible state of mind, to escape for a while from an impossible situation, to die, have relationship issues, mental illnesses are the cause. And so we look at teenager suicide nationwide have increased. We published on the changing nature of suicides in young people. As I said, over time, these numbers continue to increase, and also they increase with age. More and more children die of guns as they age, and every year these deaths keep to seem to be increasing. As of today, 2,500 deaths will happen this year in children, which is almost 10 deaths daily. By the time we finish the day, 10 children in United States will die of guns. And those who die of suicide give these reasons. So we would agree with parents and say, yes, we need some more control of conflict and provide mental health resources to children if we have to reduce suicides by guns in children and possibly homicides too. Next, we also looked at how do children look at guns. It is said that on an average, it is possible for a 7 to 8 year old in United States to fire a gun if it's loaded. And so we looked at gun carrying behaviors across the nation in children. It does seem like young people who commit suicide with a gun almost always use a parent's weapon. 44 youth suicides were examined. 36 of the victims got their gun from the home. And so the New Mexico proposal on child access prevention law, reducing access to guns for children by educating parents and holding them liable, seems to be a reasonable policy to reduce gun suicide deaths among children. And also in our nationwide studies, we find that more and more children would take a weapon to school with easy access, lax laws, and high proportion of American teenagers take a weapon to school, possibly because some of them fear the conflicts that they have to face, also easy access. Now, the next priority area is as we talk about children and suicide, and some people have a tendency to blame all gun violence on mental health problems. The trouble here is that women also have mental illness, but 98% of mass shootings are committed by men. That's argument number one for not linking all gun violence to mental health problems. Second argument is many of the mental illnesses originate in early teens, 20s. There are stereotypes, stigmas associated with mental illnesses. But the fact remains that mentally ill people are more likely to be victims of violence than perpetrators of any kind of violence. As of today, 1 in 5 people, 20% people in United States have a diagnosable mental health condition. Not all of them go around killing other people. And almost 1 in 25 also live with serious mental illness, persisting chronic serious mental illness like schizophrenia, 4%. And yet there is no reports of major violence incidents from these populations. The third argument is 50% of the people in United States would have some illness episode over their lifetime that could be diagnosed as a mental health issue. 4% will have severe and persistent mental illness. 1 in 5 today have a mental health issue. So those who want to link all gun violence to mental illness also have to wonder if this is the proportion, nature, and extent of mental illness in United States. Is it different from different other countries? Are American people more likely to play violent video games? Do American people have higher rates of mental illness? Is crime rate higher in the United States? The answer would be most likely no. If you compare them to industrialized nations, we don't have such a huge discrepancy between mental illness rates among United States citizens versus other industrialized nations. But invariably, many people end up saying, oh, it's all mental illness, which even studies show that mentally ill people, even if you remove all mental illness from United States, for if you had a magic wand, you remove every person with mental illness or cure their mental illness, you would be able to reduce violence by 10%. And still, majority of homicides will continue to occur. More than 75% of homicides, murders will continue to happen despite eliminating all mental illness in United States. So all these arguments about linking mental illness with guns in the United States seem to be becoming popular but untrue. So we conducted two studies, one with psychiatric nurses, one with practicing psychiatrists. And they said, yes, almost 40 to 45% men who commit suicide have had substance use mental health issues. Women who commit suicide with guns or die of suicide with guns are more likely to have mental health and substance use issues, almost half. But other half of people who die of gun suicides may have an impulsive decision. Also, they may have seen a physician in the last 3 months. So we asked practicing psychiatrists and also conducted a national review of all the studies we conducted. It does seem like psychiatrists, most of them perceive firearm safety as a major issue for their clients. They feel that too many of their patients who have mental health issues have easy access to guns. Psychologists, majority believe gun safety is a major issue for clients. Many of the psychiatrists actually wrote back to us that they have been threatened with a gun by their patient and they don't know what to do. Uh, Only a few had a routine system for identifying patients with guns. 27% MDs and 22% PhDs in United States who practice in the field of mental health have system to look for guns. Most of them do end up talking to suicidal patients with about guns. Uh, the problem is other studies that we conducted, not shared here. Most of the American physicians and practitioners in the field of behavioral health, mental health, have received no training in their medical school. And we have done studies with all these populations. It does seem like if clinicians have to be effective at preventing gun suicides, they need more training uh, on safety counseling. But we also know this is controversial. There was a parent who sued a physician in Florida because the physician asked them, "Do you have a gun at home?" when the parents were visiting the clinician with children. And the clinician was asked not to ask about guns. And his logic was that if there is a young couple and they have a child at home, and it seems like they could be at risk, why should I not ask about guns? And it was almost a situation where his license was to be revoked by the state of Florida. And finally, American Academy of Pediatrics jumped in and he was allowed to practice back. But nationwide, it does remain controversial. Can you really ask people about guns if they visit you as a client in the clinic? And despite the fact that they may not be at high risk, but it does seem logical when children are at home, you may want to ask. Um, the other population that's in the center of controversies many a times, college students and guns. Many institutions, universities make their own laws despite the state having different views on policy. We find that nationwide, 5% of college students have a gun, which could be more than 500,000. The trouble is many of these children, 18 to 25, have the highest rate of mental illness and binge drinking. As of today, there are 25,000 suicide attempts made nationwide per year by college students, resulting in 1,000 suicide deaths. But many policymakers and advocates look at colleges as uh, a place for more controversy. Uh, so we went to college presidents, surveyed a national sample of college presidents and college students in multiple institutions. And the majority said the decision to carry guns on campus should be left to college presidents and students, the chief stakeholders. The state should not decide what our institution wants. And these were big national studies where college administrators and students openly expressed their views that they would not be feeling safer if there were more guns on campus. So we don't oppose or support these ideas, but we believe presidents and students should be collaborating on policy making for campuses, irrespective of what the state is, Republican, Democrat, or whatever their policy is. Colleges should be left alone. Also, we went to some law enforcement officers. So we have conducted studies with college police chiefs on campuses, sheriffs, police chiefs in cities. They differ in their views, but we want to know more about what they think because they are the first responders. Overall, it does seem like campus police chiefs on college campuses and city police chiefs are supportive of tougher regulations because they are the ones who see a lot more fire, bloodshed, and are at risk. Sheriffs less likely to support tougher gun regulations. And also, campus police chiefs and city police chiefs believe they should be involved in policy making. They have actively participated in advocacy measures. And these studies showcase that, again, this is a population that should be engaged in policy making, but they are frequently ignored or they end up opposing policies. For example, when the New Mexico state implemented red flag law, the extreme risk protection law, which allows people to petition that someone who has a mental illness and is a risk to themselves, their guns should be removed. When this policy was being discussed in New Mexico and is now implemented, sheriffs were opposed. They did not want this policy because of number of reasons. For example, logistics. So apparently, if you have a neighbor or family member or others around you who have mental health crises and they also have a gun, you should be able to call police and say the guns should be removed from this person. They may end up killing themselves or others, but apparently sheriffs would not support that or work on those policies. It is complicated. You have to go to the court at times. Not everyone is eligible to file a petition. So, in summary, what do we do now that we have so much of a problem and continuing to escalate? I think we have some evidence to show that tightening of sales of certain firearms and ammunition, like in the state of New Mexico right now, they're discussing what type of people should have guns and what type of guns, how much of ammunition. And some people also say that what is the use of an assault weapon for a civilian? No other country has these issues. So maybe we need to reconsider. For example, in Australia, they had a mass shooting and then civilian assault rifles were banned. We also need more universal background checks and permit to purchase. People who have domestic violence cases against them, maybe they should not be able to get a gun. We also need more work in technology and education of people. 20 million people bought a gun in the pandemic. Clearly, there's a need for more education and safety training. Some laws seem to be effective. Child access prevention law finally coming to New Mexico, where parents are held liable if a child accesses guns and kills someone. Red flag law also in New Mexico and a bunch of states, almost 25 states now. This law is known as the Extreme Risk Protection Order, where if you have someone around you, they are a risk to themselves or others and have a gun, have a mental health crisis, call the police and remove the guns from that person temporarily, not permanently. Some emerging issues are what happens after the pandemic. I feel like more and more poverty, socioeconomic distress, higher amount of gun ownership, to the extent that the risk of death increases for a person almost twice if they have a gun at home compared to those who don't have a gun at home. We also have some ghost guns, toy guns shaped like real guns, and kids start playing 3D printed guns. So we did some studies that I can share with you later that there are some laws that actually might end up becoming more effective if they're tightened. We compare states with and without these laws or categorize them as strong law, weak law, no law, three different types of states and look at child gun death rate, child suicide rate, and child homicide rates and find a decline with more tougher regulations. Um, Finally, also, we have to increase funding for firearm research. If you look over time, there was a time when CDC was banned from funding any gun violence research. CDC used to fund a lot of injury prevention research, and finally, the Congress decided, due to one legislation, that any kind of funding from CDC, injury prevention funding, should not fund gun violence research. I believe it was Dickey Amendment. And finally, under the newer administrations, starting from Mr. Obama to date, there is some money available. But the problem is, as you reduce the amount of government funding for research, you really don't know how to find a solution because these studies take money. And so we look at number of publications on guns and research available. It has declined since the national ban on funding research through CDC. It may now seem to increase some. We also don't know to what extent is the general public involved in advocacy. Healthcare professionals seem to be distant. They're not trained, they're not asked. They're sued if they ask patients about guns. Again, law enforcement officials have similar feelings at times. And school personnel believe that they are prescribed something and that something is useless. Students and parents also need to play a major role in communities to reduce gun violence. So we advocate for more funding, resources for mental health services, especially we lose too many young people, engaging law enforcement officers, and solutions should be community oriented with extensive citizen participation. In East Coast, I would believe there are other competing priorities. So nationwide, we rank in the top 5 in homicide, suicide. For us, we need more community-oriented solutions because of the local context. But East Coast, they have lower number of homicides due to guns and suicides. So they may need uh, a different kind of solution. Despite the lack of research funding from the government, I'm thankful to my collaborators. They spend a lot of money out of pocket to fund these studies. And as you can see, there are diseases that are of less burden, cause lesser number of deaths and disability, and yet continue to get more money from government sources and also get more publications and scientific literature. So this is funding by $1 billion and number of deaths. Despite gun violence having 15 people die of out of 100,000, the amount of funding has not increased. Some problems that have lesser mortality, lower number of deaths actually get more funding and more attention. And we share some examples. And no offense to, for example, people with HIV. 15,000 people will die of HIV this year in United States compared to 45,000 dying of gun violence, 3 times more. But funding, a lot more funding for HIV through drug companies, government and others. It is considered priority for them, but too many young lives lost is not a priority. So I just share this with you as for the context of why we need more money if the problem has to be solved. And finally, thank you so much. I hope I was able to quickly summarize the state of affairs today.
Wow. Thank you. Thank you so much, Dr. Chandani. This was a lot of really interesting and good information, but also a very sobering picture, right, of the situation in the United States. We have several questions here, so I'll get started. I have several questions of my own, but I'll get started with the ones that were posted already. Dr. Dulcinea Lara asks about the imagery and glorification of weapons. She asks, do you think that the imagery and glorification of weapons have bearing on gun violence, increasing incidents? If so, do you think NMSU should change its mascot who wields a gun and who's symbolized by 2 guns?
Yeah, there is a study from Arizona on copycat mass shootings. So the fact that we had a mass shooting in our region quickly will be followed by other mass shootings due to glorification, people looking at this as a claim to fame. So yes, those tendencies do exist, and there has been studies to show we need to reduce the glorification, showing pictures and such. For NMSU mascot, I think I was on a tiger team early when I came to NMSU. I would be okay if that's changed. From an international perspective, someone who was not born here, I can say many parts of the world would look at this as an odd symbol of our existence, a man with a gun.
Yeah, I fully agree with you. I was in faculty senate and we tried passing a resolution to change the mascot. It also born internationally, but having lived here half of my life, it still seems a strange mascot to me. But I do understand other people have different ideas. Still, if there is some research about glorification and imagery and mimicking, then this should be good food for thought for our parents, our community, and our staff and faculty to think about perhaps making that change.
Yeah, and I've shared, I think I mentioned Arizona, but it was Arizona State University 2015 study that showed contagion effect of mass shooting. So there is an effect of mass shooting that seems like a copycat pattern. And so in the next few weeks, we will see somewhat of a tendency for more mass shootings. And this was published in PLOS One in 2015. Yep. Glorification and then the media portrayal does increase tendency for mass shootings in the near future. And that's why I think as I said in one of my slides, the more mass shootings we have now, the average time to another mass shooting keeps dropping down, which also shows a contagion effect.
Yeah, and that is very disturbing information, right? So a few of our participants are asking if the recording will be shared, and as I said, we will share the recording in our YouTube channel, in our Collabs YouTube channel, and it's at NMSU Collabs. We post all of our speaker series there, so it will take us a little time to transcode. So give us some time, but it should be posted there. If you follow us in our social media, we will alert you when that's posted. But some other anonymous attendees are asking Dr. Kupchandani if the PowerPoint can be shared also, because there are so many good uses for this condensed information.
I'll send it to you now.
Oh, thank you. So we will be posting it then in our chat if you're interested. There was a question about New Mexico and the percentages, the really high percentages of children that die in New Mexico from gun violence, right? And an attendee asked if there was a correlation, or has there been any correlation in the literature found between lower levels of education and higher levels of gun violence?
Yeah. Poverty is a strong indicator of gun violence in a state. And that, again, we controlled for. We did a study comparing states with weak laws, strong law, and strongest law. And we adjusted for poverty, family dysfunction, and still found that if we had tougher laws, the poverty effect would be nullified, even though poverty has been a strong predictor. And now I think out of University of Washington, Ali Rohani Rober is the name. They have a big injury prevention center. He has published a study on earned income credits, guaranteed basic incomes for citizens, and has shown a reduction in gun deaths in a community that receives earned income credits. Wages are increased, and they have guaranteed basic incomes. So yes, poverty plays a big role.
So yeah, so reducing inequalities helps.
Yeah. I mean, the fact that there are people who are disproportionately affected. African Americans have the highest likelihood now of gun deaths. Clearly, there's also most of them concentrated in 15 states in the South, and where neighborhood dysfunction is prominent, there's a strong function. But again, that despite that, there are many other places in London where there's poverty, United Kingdom, parts of Europe. Still, they don't have the kind of deaths we have. So poverty, yes, is somehow a pathway, but it's not the major cause and effect relationship establisher.
And that makes perfect sense. So you had anticipated that. Oh well, actually, we just received another question. So this was going to be my question, but I'll actually ask this one. You said that programs that we're implementing in school, these technological things, et cetera, weren't helping at all. Then what are some helpful programs that we can implement in our community, and what some other things that can be done to kind of curb the what seems escalating death violence and deaths from violent shootings and deaths from guns, whether it's self-inflicted or by others?
Yeah, I think as I've shared, the school shootings are comparatively rare compared to all children's deaths in communities. And even if we focus on school shootings, you have to engage the community. Most school shooters originate from the community. They had a past connection with the school, relationship issues and such. And almost half of the times they gave a warning, and that warning went unnoticed. So we have the profile of a school shooter belongs to the same community, and we need a community-based approach to alerting, better monitoring systems, improved mental health resources, parental involvement, especially when young children get guns from homes are the primary source or family members. And so there are studies showing that with those comprehensive approaches like child access prevention law, tougher like legislation in the community would reduce the amount of shooters in school who also happen to be young people. But the idea of having more devices and hardening the schools may not help. And then, I think there's an opportunity cost as well. How much would you want to spend in a school compared to spending on a counselor, community resources, community engagement? So those are other things to consider as well.
Thank you. There's another question from someone anonymous. Thank you for your presentation. Is there any relationship between the purchase of weapons after mass shooting events? So do weapon purchases increase after mass shooting events, as in Uvalde or the Walmart shooting?
Yeah, there has been the gun violence archive that tracks gun deaths in the United States and the FBI. You can plot a map and see before Mr. Obama's election, before Mr. Biden's election, Mr. Trump's election, big increase in sales. Then the pandemic, and also after the Florida shooting, Uvalde, there were spikes nationwide in gun purchases. That's clearly documented. And could be because people feel now politicians will react and take away our guns, make the policies more harder because of this mass shooting. So we need to accumulate guns.
Another anonymous attendee says, this presentation was fantastic. Thank you, Dr. Khubchandani. This is such an asset you are such an asset to our community. So that's very well received. I echo that attendee. I did have a question. You kind of left it for us to talk more about it, you said, and so I'm asking you to talk more about it. You said there are some laws that are making a difference. So kind of local, state, perhaps even national laws that are making a difference. So what are some of those?
So, background checks and then child access prevention laws, extreme risk protection orders, earned income credits could be some of the examples. But by and large, the RAND Corporation suggests before we make a judgment, we need more research. So occasional sporadic studies do show effects of protection from these laws, but we still need more. In part because we don't implement too many policies, and it's getting difficult day by day to implement newer policies.
Yeah, and regretfully, I think, as you pointed out, the political divisions in our country are making this harder, right? Instead of us kind of thinking outside of the very politicized environment and thinking, okay, we can solve this if we actually work together. It seems like the hyper politicization and the hyper division in our politics in our country are making harder for us to kind of get to some of these laws and resolutions. So hopefully we can see past that.
And some seem to be so logical, like the minimum age requirement or waiting periods. Why would someone want a gun right away? There has to be some intention to hurt themselves. So waiting period policies may seem helpful in reducing suicides. Minimum age requirement, we know young people have a lot of distress in today's time. So it would be helpful to continue to increase the age of gun ownership. And then children, again, parents have to be involved. And there is others that I think need more research, like training on firearm safety. I don't know, the evidence is inconclusive, but if you train people, maybe they know better how to lock their gun, store their gun. And others that are being proposed in the state of New Mexico, ban on assault weapons, may be helpful based on past evidence.
No, and it makes sense. And the reducing inequality through the credits also makes sense in terms of you have pointed out the populations that tend to suffer more from gun violence tend to be minoritized populations with high income inequality, et cetera. So, and of course, with parents that probably have to be in 2 or 3 jobs and therefore are paying less attention to their kids, right, because of those needs. So reducing those inequalities, giving parents hopefully a larger chance to be more involved also would help. It makes sense to me, at least. There's one last question, since we're kind of running out of time, and there are so many questions, so that's a testament to your talk and of course the importance of the topic. What are your thoughts of gun violence at the hands of law enforcement, which is also higher than other industrialized nations or peer nations? In I guess my guess is they mean that it's also higher in the United States than in other industrialized or peer nations.
No, this is, I'm glad you discovered. This is one of our latest studies showing that there's a spike in Hispanics being killed by law enforcement officers. The second most likely to be killed by law enforcement. The first would be African Americans. It does seem like the numbers keep increasing, and there is more unrest in the police force. Maybe there is a need for a broader nationwide discussion, especially around here in the Southwest. New Mexico actually would move to #1 spot. If you look at population size, we have more people killed by police officers, and a number of reasons, So we have at times citizens who are heavily armed. At times, the default mechanism of responding of police officers is to end up shooting someone. So we did study and called for more police training and community engagement. And too many people are being admitted into the police force without stringent training requirements, given the shortage of police officers. So both directions, I think number of citizens who are armed increasing, and especially young people shooting back at police officers as a default defense mechanism is both ways. But yeah, in both African Americans and Hispanics, the rates have spiked big time, especially in this area, Southwest.
That's terrible to hear and regretful. Hopefully training, hopefully,
Yeah. Yeah, and some cases when we have a mental health crisis, we don't need to have a police officer responding to it. Like in Las Cruces, a 75-year-old lady, and she had a knife in her hand, she was shouting. The family members called the police. The officer comes in, he's at a 12-feet distance, and he shoots her. How could a 75-year-old lady with a knife kill a police officer? But he reacted, And then there's lawsuits following now.
Well, thank you so much for agreeing to being our speaker, and thank you so much for a wonderful presentation. So sobering and difficult topic, but this is another thing that it's important to keep talking about, right? In other words, the more we inform people, the more we have actual information, numbers, studies told to our community by experts like you, the more people can start understanding the complexity of this problem, the many different ways that we need to be dealing with it, because it is an epidemic and because it is becoming more and more pervasive, and how we need to attack this from different points of view and sectors. Public health as a public health issue, as a law issue, as a parent involvement issue, as you have made very clear, and as a mental health issue. So I really appreciate your time. I really appreciate you coming here and having us having the opportunity to hear from you. So thank you again.
Thank you, Dr. Ortiz. Thank you, everyone.
Thank you, everyone, for being here. And we will for sure post this in our YouTube channel, but also if Dr. Khubchandani shares the PowerPoints with us, we will share them with you. I appreciate it. Again, my name is David Ortiz. I am the faculty fellow for the Center for Latin American and Border Studies, and thank you all for being here.